Hello and welcome to the Nurse Wellbeing Week panel, Use Your Voice for Good. I am joined here with three wonderful panelists and guests to speak about how to use your own voice as a nurse and a bedside care professional for the betterment of our community. There are millions of nurses out there working the bedside right now in these dire times, challenging times, and it's more important than ever that I think we empower nurses and bedside professionals to use their voice for good. That's why I'm so excited to speak to everyone here because they have done just that in their own bios and experiences. So I am excited to welcome Nurse Keith Carlson. He's a home hospice nurse, home health, and has worked in case management. Currently a holistic nurse career coach, helping nurses with their resumes, networking, confidence, and career vision. You can find him on nursekeith.com. He also hosts a podcast, The Nurse Keith Show. I'm also joined by Dr. Kelly Aldrich, over 20 years as a bedside nurse, informatics nurse specialist, was the first ever chief informatics officer for HCA's 170 plus facilities. She's the director of innovation and associate professor at Vanderbilt University School of Nursing and senior nurse executive for the Center of Medical Interoperability. We also have Theresa Brown, clinical nurse, published author, recent book called The Shift was a New York Times bestseller. She's written on CNN, New York Times, American Journal of Nursing, and more. She's worked as an inpatient oncology nurse and a home hospice nurse, and she actually has a new book coming out in April titled Healing When Nurse Becomes the Patient. Thank you, everyone, for joining me today. So let's jump right into it. My name's Zach. If I hadn't introduced myself, my background is I'm a bedside nurse. I've worked for about 6 or 7 years bedside and helped start a company called NurseGrid. And I recall during my time as a bedside nurse that I was advocating for my patients every shift, every day, and trying to do the best for them and advocate for them. And then in my role at NurseGrid, it was about taking that advocacy and leveling up to help advocate for other nurses through technology. And so I think that's sort of a great place for us to start. NurseGrid, our mission was to bring innovation into the medical workforce. So Kelly, I wanted to start with you. You are the Director of Innovation at Vanderbilt University School of Nursing. So where does innovation come from?
Well, Zach, I think you just pointed out exactly. You saw an opportunity and something that could fill in a gap, and you did it with your company. So with nurses, what I see and what I know around innovation is oftentimes they're really frustrated with technologies or processes that are put in their path in order to take care of patients. And here's my answer. Anytime there's a workaround, there's an opportunity for innovation. And if there's a workaround, that means there's a failure point, either in how the technology or the process is supporting the care of that patient. It's actually providing or putting a burden on the care teams. And so where I think around innovation is it's not necessarily around the innovation, it's the transformation to fix those failure points. And that is something that nurses know all too well. They know where the failure points are in healthcare. We all know this. I think that resonates with every nurse. And the frustration, however, is that they don't have time to fix it necessarily right there. So what are the things that we can do to infuse those opportunities in a health system so that they can actually right those wrongs? And that's where my role at Vanderbilt is how do we infuse innovation to create those transformations of care, both in the education process as well as in real practice?
And you're working with nursing students who haven't even been working bedside as a nurse at that time and trying to help train them to enter the workforce with that empowerment in mind, to use your voice, to see the problems that are in front of you, and then either speak up or use your voice to help implement change. Do you have any good tips or advice, or what advice do you give to your students on the best way of entering the workforce and when they see some of these issues, trying to use their voice?
Right, 100%. I think that's where my role was when I was at HCA. Was I was asking where are the problems? Can you identify these issues, and can we work together as a team so that we can just start prioritizing the issues and start working through those? And so my advice is don't keep it to yourself and quit with the workarounds. Call it to someone's attention. It could be really hard, but I've done several publications on how you partner with IT or how you partner with senior leadership through nursing journals that really can give you support in a roadmap. And it might be something as simple as going to your local council with your nurse manager, or if you're the nurse manager or chief nursing officer, go to the council and call it out. The fact is if it's a failure point for you, it potentially can cause harm to the patient and it's causing problems for your colleagues. And I think it's time that we stop just keeping these things to ourselves, but we actually escalate them into action items to create not only that innovation, but the transformation that we need. So I would say you have to speak up. And if you're too tired, which is very probable, you need to possibly even just make a list and turn them into the council as failure points, and let some other people advocate because you're not the only one who's having that problem.
I think sometimes just writing things down can be really helpful for you to process your own thoughts, maybe weed
Yeah.
out some thoughts and go through that. And then at least you have something to hand in, because otherwise they're not going to hear from you unless you find ways to communicate whatever it is that you're seeing.
Yeah.
Teresa, no,
Sorry.
go ahead.
You
Sorry.
know what?
No, good.
I'll add to that, because I think an action to add on to what you're saying is, can you picture what the ideal state would be beyond the current
Mm.
state, and then write that part down? What would you want it to do? And then that's where the opportunity is for the team to jump in and make something real for you. So thanks for letting me add that.
Yeah, absolutely. And Teresa, you have done just that. You've taken your own thoughts and opinions and stories and put them down on paper using your voice to help write a number of successful books. Can you talk to us about that decision making that went into and that process for going from a nurse to also becoming a writer?
Yeah, well, I always feel like I should say I do have a PhD in English, but academic writing is so different from the kind of writing I do about nursing and healthcare. And I think until I became a nurse, I taught English in college, but there just wasn't something that sort of tripped my imagination enough. But then I was still a pretty new nurse, and I had a patient die very suddenly who was supposed to go home. And it's interesting, so many nurses, I think every nurse has this experience, some experience like this, where you're a new nurse and you have a patient die suddenly. And for me, it was just very traumatic, as it is for all of us. And I couldn't get out of my mind. And then I thought, okay, I'm going to put this down on paper. I always say it's like the pensieve in Harry Potter, you know, where you put like the pen up to your head and you pull out the memory and put it in a bowl, and then like, that'll be fine. Okay, so that doesn't work. But I did really like what I wrote. And I thought, okay, well, aim high. I am going to get this published and I'm going to send it to the New York Times. And then I did have a friend of a friend who was an editor there who said, this is really good. I'm going to send it to the Science Times. And they said, okay, we're going to publish it. And then, so everyone knows this. Okay, so it took 6 months. Like, I was getting ready seriously to write to the editor and say, did you forget about me? When I got an email from him saying, we're finally publishing your piece. Like, okay, great. You know, basically I wanted it to come out and I would show it to my friends and I would show it to my mother, right? Like, I hadn't thought anything beyond that. And it got interest at a level I was not prepared for and sort of couldn't believe. And I actually got the contract for my first book, which is called Critical Care. It's about my first year of being a nurse, from that piece of writing. But what I want people to hear is, yes, in a way that was all very lucky, but what people said to me, the agents I started talking to, the book editors, was, this is a voice we never hear, the voice of a bedside nurse. And that was so meaningful to me, because here I'd come into nursing as someone with a PhD. I thought, I'm just going to blow through bedside nursing and I'm going to get my advanced degree. Not that there's anything wrong with doing that. But once I got into the job, I saw, this is an amazing job. It's so important, and it's just not respected the way that it should be. And then I saw my writing as an opportunity to bring that respect to nursing, to really show what nurses do, to show how important we are. And that's always been my mission, and I do think of it as a mission. That's always been my mission, whether I'm talking about having a terrible day and what that's like. Or I did a whole column called Our Healthcare System is One Big Workaround. And I completely agree with Kelly about workarounds. I've talked about lots of things about end of life because I worked in home hospice, doctors bullying nurses, the whole epidemic of bad behavior in healthcare that's only about 10% of the people, but has this really bad trickle down effect. I mean, all kinds of things. And really wanting to show people who, from Grey's Anatomy or whatever stupid medical TV show is on the air, makes it seem like, well, doctors do everything in the hospital. That no, actually, it's nurses who make the hospital run. That is just true. And patients go to the hospital for nursing care. That is also true. So that's what I am trying to get across with my work. And what I want to say to other nurses is, if you feel like writing about nursing, that's great. But if you feel like you hate writing, I just want you to talk about your job. Tell your husband what you really do, or your wife. Tell your family what you're up against every day. And I think the only positive thing for nurses to come out of COVID, there may be others, but is that the public has really seen what nurses do. And I think that's for the most part been very well done. And I think it's wonderful, although it's terrible what nurses had to go through to get that level of coverage. But that's the message I want you to take away. Tell the truth about your job.
No, I think that's great. And I would like the record to show that we're awarding Theresa 10 points for the Harry Potter reference. So if we can make sure that gets on the record,
score.
Someone will mark that down. Thank you. I love that. And I don't think that it's always, you don't have to write a book, right? It's not like you're saying like using your voice is about writing a book. Sometimes it can just be writing your thoughts down for yourself and helping you process those thoughts. Sometimes it can be a blog. Sometimes it can be just your social media audience and platform and friends and family. I do think there's a number of misconceptions about nursing. And I think the more the general public understands about what it is and what it takes to be a nurse, the better they can support you as their friends and family. Maybe the better patient they can be. We all know that there's a lot of misconceptions about what nurses are and what they do when patients come in. And I think just that general awareness, we've seen more of that in the last few years because of the focus on nurses in the pandemic. But I think your writing in particular, I know that the New York Times article that you wrote was really great and did a wonderful job at reaching a new audience of people and helping them understand what it is that nurses go through. Keith, you have used your voice in a more one-to-one way when you're working with nurses as their career coach, but you've also had this podcast now where you're speaking to many more through your audience too. Can you talk to us about some of the barriers that Kelly and Theresa were talking about, maybe some of the barriers that nurses are encountering in their own career and journey?
Sure. And I've also been documenting my own journey and journey of nurses in the healthcare system as a freelance writer. And I've been blogging about nursing since 2005. So I've been reaching people in different ways and also through social media. And what I am gathering from the many, many nurses I talk to and the ones I hear from and the ones I just observe out in the space their conversations happening is that there's many things standing in nurses' way. So first of all, it's true that workarounds are something that nurses have to become completely adept at. And Kelly and Theresa are right that the whole thing is a workaround. And nurses are trained in critical thinking, and they need to be able to puzzle their way through many conundrums in the course of their days, whether they're a school nurse or a nurse practitioner, or they're working in a dialysis center, they're in a acute care, no matter where they happen to be. And what I'm gleaning also is what Theresa mentioned, is that nurses, while they feel recognized, there's been lots of stories in the media, which I think has been one of the most positive things for nursing, like Theresa said, in terms of COVID-19. The public and the media still don't necessarily understand what it is we actually do. And Theresa making the point of speaking to your friends and your family and your neighbors and the people who you know in your community about what you do and what you face every day is a very important thing. And it can be a very lonely thing to be slogging away out there and not having people truly understand what your days are like. And honestly, how can they truly understand in the end? But we can do a better job of explaining it. And there have been books about how nurses could be more public about how they feel and what they go through. There's Suzanne Gordon and Bernice Baresh from Silence to Voice. There's other books and many articles out there as well. And I think part of it is taking personal responsibility for what our experiences are and being able to communicate those. And you're right, it doesn't have to be a book, doesn't have to be anything huge. Blogs are great, social media is great. It's so easy to voice our opinions and feelings and experiences these days. Anyone with a LinkedIn profile can publish their own articles now, or they can publish on Medium and other places. So I think that ability to articulate what it is we're experiencing is important. And I think it's also important for nurses to use a cliche, but the cliche works, and cliches are cliches for a reason, right? Because we use them, is to speak truth to power, to be able to go to our congressional representatives and our senators and to meet with our state legislators and even our local city councilors or mayors and be able to tell them what our true experiences are. Because if they don't know, if we don't educate them, that's one of our main problems, if they don't truly understand. And something I've heard from a lot of nurses and something I've been feeling myself, and even today I heard this. I was doing COVID testing here in New Mexico, and someone thanked me for being a hero. And I said, okay, thank you. And I've written some articles online about this notion of the nurse hero. And the notion of hero is great, but it also, for some nurses I've spoken to, they seem to feel it dehumanizes them in a way. It makes them into this thing other than human. And, like you think superhero. So I've been writing about and talking about this notion of the nurse warrior instead, because that gives us more of for me, a more human perspective on what the nurse is doing out there every day. The hero doesn't quite get it for me, but a warrior really does. And I think nurses who've been on the front line during COVID really feel like warriors, and I think they truly are. So there's plenty of things nurses are up against. There's plenty of things that I hear, and I think this ability to articulate our experience is one of the most important things we can do, just for our own healing and our own well-being, but also for others to understand.
Yeah, that's I think Nurse Warrior sort of encapsulates a lot of it, especially as nurses now we're going through this third wave of COVID, and the sort of just the repetition of battling this virus and working with these patients is exhausting and tiring. And you just have to imagine the nurses that come out of this on the other end are going to have quite the experience to look back upon. I don't think nursing will ever be the same as a result of what we're going through. Theresa, did you have something to follow up on with Keith?
Yeah, Keith, that was really nice, and I like the warrior image also. I wanted to put in a caveat about speaking up, even though I do it and I recommend it, and and I've said this before, and then people will say, well, you're saying nurses shouldn't speak up. And no, that's not what I'm saying. I'm saying from my own experience, I ended up being chased out of my hospital, and ended up writing about this for the New York Times. A column said called "Why Hospitals Don't Want Nurses and Doctors to Speak Up," talking about sort of corporate branding, but there is a risk, and I think, since I know there are a lot of new nurses listening, but also managers too. I mean, I think I always tell people, don't name your hospital. Of course, observe HIPAA, but as much, if you're telling a patient story, if you're talking about something that happened with a doctor or a colleague, as much as you can disguise that person while still keeping the truth of the story. Because of HIPAA and a sense of ethics around patients, it's important to respect that. But also, some hospitals are cool with having nurses be on social media, and some just really are not. If you have a choice of where to work, obviously it's better to be in the first kind of place. Not everyone has a choice. So think about that. Be careful. To managers who are listening, I would say try not to just toe the corporate line in these situations and think, well, we don't want someone speaking out if that is the corporate line. Think about, as Kelly was saying, what is this person saying? What is this frustration that they're dealing with that they have tried to bring up and nobody's listened, or only they have brought it up and they haven't brought other people with them, or whatever. If an employee, really hardworking nurse, and it's very rare to meet a nurse who's not hardworking, but if a hardworking nurse is saying this is a problem, why not try and listen to that and understand where that person is coming from? And maybe you wish they'd express it differently, and maybe you wish they hadn't put it on Twitter or Facebook, but it's still a problem, right? It's still something worth paying attention to. And so that communication can be a collaboration instead of nurses and management seeing themselves as adversaries. And I would say that's ideal, and it just does not happen enough.
I do think that sometimes good advice is don't say anything online that you wouldn't say to someone in person. Sometimes that little filter that you can put, you think before you say something, can help you just think through exactly what you're about to say and make sure that it's something smart. Obviously, nurses have a lot of opinions and a lot of thoughts and ideas, and ultimately want the better for themselves, their community, and their patients. So I think finding that balance is really important. Kelly, you've been a chief officer for a large health system that has overseen tens of thousands, maybe over 100,000 nurses and bedside professionals. Can you talk about that experience? Because you worked as a bedside nurse too, and you've also now been a chief officer. Just what it's like to sort of be on both sides of that aisle.
Right. I think not only is it important for you to speak up for yourself. So, Theresa, I agree. I think there's risk there, but I think it's worth the benefit. And that's to improve and advocate for not only yourself, your patients, but those that are working around you. And I think that from being a bedside nurse for so many years in critical care, did open heart recovery, I was an ER director. I did that for a number of years. I was a chief nursing officer. And then I found my way into this large corporation that it just seemed to keep adapting, because I kept speaking up for what was missing for the nurses. What was missing? Where was the technology? One example is I just couldn't understand why all the med-surg nurses and techs were writing vital signs down on a piece of paper and transcribing it in 3 different places. And I happened to be doing my doctoral work, so I asked for this project to be funded. But the way that I did it was I actually went to the boardroom, created a business case. So I looked at what the problem was. I created a potential solution, and I got myself on the agenda in front of the group presidents, and I said, "Can I take one of your blood pressures?" And so I literally took their blood pressure and wrote it on a piece of paper. and then told them in 6 hours, someone will take a look at that and see if there's some trend, if you're actually deteriorating or not. And they were all blown away and couldn't believe that we were actually functioning in that environment. And what I shared with you, why I say that is because it's an awareness thing too. Theresa, you're spot on. People don't understand what nurses do day to day. So how will they ever know the frustrations that you have? If you cannot stick up or bring these points forward, like I said, bring them into a council. But I also feel very strongly in leadership roles like I have been in and I'm currently in, is we have to take the time and the effort to go reach into the bedside care environments and find out what is the problems, what are the problems within that environment, and then create solutions. So for example, and you all can do this, I did a call for innovation. So I asked the chief nursing officers of the company, could you ask the bedside nurses for 2 shifts to take a 3x5 card and write down every time you were irritated or frustrated over something? A 3x5 card, and just give them to me. So I think 80,000 responses later, I think, or some, it was something ridiculous. It's been a number of years, I don't know, but we created very, very high and tactical roadmaps from that. So meaning all it was a question. How about if you ask your colleagues, do you all find, are you irritated with this? What are the top 3 things that are a problem? Put that down on a list and hand it over to somebody. Give it to your chief nursing officer and say, this is not working for us. There is nothing wrong with that. And it actually, you may find that is a welcome activity so that there is an action item that they can take. Just like nurses don't go to work to harm patients, chief nurse executives don't go to work to ignore those that they represent. They are trying to advocate for you, but if they don't know the issues, they're not going to do the best job for you. So I think just simply writing down a few ideas, at a staff meeting or something, do a poll. Maybe you have a school project or you're doing a performance improvement for your review project. Come up with some ideas like that and turn them over and see what happens.
Yeah, I love that. And I think sometimes it's so nice to have a CNO who makes themselves open and will ask for those comments. And I think sometimes if you're not being asked, then you still have to find ways to offer that information up in a way that is calm and appropriate, and ultimately making sure that we're always positioning ourselves as looking out for the good of our community and our patients. Keith, can you talk about your experience working directly with nurses as a career coach and how you help them use their voice for good?
Sure. And one thing I want to dovetail on first, regarding what Kelly said in terms of chief nursing officers and executives, the people that you brought something to the board, Kelly, and you said, let me take your blood pressure. And so I just wanted to add a little something that if you're a chief nursing officer or a COO or a CEO of an organization, and you are not regularly shadowing your nurses on the floor and watching and observing and listening very, very carefully, you're missing out on something very important in terms of your ability to assess the situation. So it's great for people to write things down. It's great for people to force their way into the board to tell a story like Kelly did. But I always like to say you have 2 ears and 1 mouth for a reason, so that you listen twice as much as you talk. And if you're talking more than you listen, then something needs to change. Anyway, just wanted to say that. And many of my clients actually bring me issues like that they don't feel like there's someone they can go to actually share where they're actually going to be heard. And I think a lot of those nurses might feel like, well, my CNO has 2 mouths in 1 ear because they're talking twice as much as they listen. And something's wrong with the anatomy here. But seriously, there's this need on the part of nurses with whom I speak that they feel like, to a certain extent, not all, but many, feel like so much cannon fodder. They feel replaceable. That if adhere to the peer pressure of mandatory overtime, if they don't adhere to the peer pressure of not speaking up and not saying anything and not taking those risks like Theresa did. And Theresa, I remember the story very well of what happened to you when you spoke up. I remember reading that. I remember talking to you about it. It's a real cautionary tale, and nurses need to understand that when they speak up, that there often can be consequences. But we need those of us who are willing to do so, whether it's on social media, writing for the New York Times, or just meeting with your CNO. But a lot of my clients bring issues to me where they just don't feel heard and seen, and they don't necessarily feel valued. They feel like they're seen as a warm body, like I said, so much cannon fodder, and they want to be working in organizations where, one, they feel like they're valued and seen for who they truly are. And they also want to see that there's a leadership funnel, that there's a place for them to move, that they're not just stuck where they are, that they can move into leadership, that they can take responsibility, that they can become more part of the fabric of the organization and not simply a person doing tasks, a task-oriented worker. And they also want to feel that there's a place for them in terms of their values being aligned with the values of the organization. So a lot of people who come to me bring to me these stories of how they feel like they're sacrificing their values on the altar of work, and their workplace is not reflecting their values back to them. And that's a real challenge and conundrum faced by nurses. And I often help people extricate themselves from jobs of that nature to find places where they feel like they can truly contribute and be seen for their contributions.
I think too, it's, oftentimes we find ourselves in these echo chambers where we're seeing and hearing the same people say the same things, and that's why it happens on at every sort of level and all sorts of jobs. And it's important to break out of those so that we can hear other people's opinions and perspectives, gain a broader empathy for what everything is going through, because there are challenges all around the healthcare system. We're all trying to improve those challenges, and sometimes doing it from within may not be the best place for you to make your change. In my case, it was trying to take what I was seeing and create a company to impact change on the healthcare system, and in particular for nursing. Theresa, can you talk about being inside the healthcare system and then sort of stepping out with your writings and trying to make some change that way, but just that sort of difference from making change from within versus outside?
Yeah, that's a great question. And I still haven't, there's still a part of me that wants to be back at the bedside. Basically, I had been teaching at University of Pittsburgh, teaching in nursing. And then when the pandemic hit, I wanted to go back to work. And one of my daughters just made it clear to me that she just did not want me to do that. And having been diagnosed with breast cancer 2 years before, I felt like I needed to really honor her feeling like that. So it was a bit of serendipity that I had to embrace this. Well, I'm a writer now. I'm a nurse and who's a writer. But the nice thing about it is that I have so much more room to think and to really think about, well, what can I say? How could I make a difference? And I don't have that stress, to be honest, to feeling like I'm sort of butting my head up against a system that is just so difficult to make any kind of change in. And Pittsburgh is acknowledged to be a difficult healthcare environment, which is a long story. But so I've had a lot more time to think about, what could really be done. What are the barriers? What's possible? And the book I have coming out called Healing, it's coming out in April, really ended up being a request for compassion for ourselves as caregivers, compassion for patients, which might sound really simple, but it's not. because everyone is so pressed for time. Everyone's just a little bit busier than they should be. Sometimes people are a lot busier than they should be, as they were during COVID. And, there's nothing that says compassion and making money in healthcare are mutually exclusive, although it's kind of ended up that way. But I don't think it has to. And so getting at the idea of respect and environment, this all sounds a little bit vague, but I guess I've had time to think about that. Yeah, it's the system, but sort of what in that could we change that doesn't involve, say, let's change the entire way we bill for healthcare, which I, Theresa Brown, am not going to be able to pull that off, So can I get people to think about the problems in a different way? And one thing I wanted to add on to what Keith said was a real sea change I've seen during COVID is that nurses are actually getting therapy, talking about therapy. Kelly, you probably know this, but I've known ICU nurses who say, well, we don't do feelings in the ICU. And so nurses talking about therapy and feelings, it's enormous. I mean, for one thing, when I first heard that, I thought, wow, we are really in trouble. And then I thought, no, this is really such a positive, healthy thing to acknowledge as a profession that what we're going through is really, really hard. It's really hard to go to work and have people die. It's really hard. Most people, that is not on their agenda for their workday ever. And I think doctors are similarly kind of opening up. So that sort of dovetails a little bit with this idea of what can I do not in the system. That's something nurses can do for themselves, but I am not saying that that's enough. I mean, still, if you feel like you need to push on your work environment, if you need to talk to your manager, if you need to go to your CNO, it's not that it's on each nurse to just make him or herself better. It's on all of us together, speaking up in whatever way we can, but then also taking care of ourselves in whatever way that we're able. It's two tasks, at least two.
Certainly, I think, no one thing is going to change everything. A lot of this is sort of collective voices, but I do like what you said about using your voice almost for introspection and to help yourself. It's important that we're all putting ourselves first too, and our families. And Keener, which is one of the sponsors of Nurse Wellbeing Week, is a free app for nurses that helps them kind of create that space to decompress for their own well-being. There's even a shift reflection, Kelly, sort of what you're talking about, like just kind of reflecting on your experience this particular shift, to track your shift by shift experiences and have it sort of documented. I always thought that particular feature was really interesting. But Kelly, I also wanted to talk to you because your role, or one of the roles that you've had, didn't even exist when you were placed into it. Can you talk about that experience, about your sort of trek and to make positive change in your systems and in healthcare, and how that led you to be in a role that didn't exist before you found it?
Yeah, I'd be happy to. And I actually, when you said that, Zach, I thought, which one? Because I've probably been in the last 10 jobs I've been in. There's not even a job description until I just start working in it. And then,
Trailblazing.
So I guess which one? No, it's really important to, here's the thing. I always say yes. I say yes to opportunities. I agree. So Theresa, what you were saying, it really resonated with me. My husband asked me maybe after about close to 18 years, how come I don't have any friends that aren't nurses? And I think that was and I thought he was crazy at the time, but now, I think I've reflected on that, and I wonder that too. And so I just felt like I had to call that out, that I don't think that we recognize that in ourselves enough. I still have some of my dearest friends are ICU nurses that I worked with back in the late 80s, that we worked the night shift together. And we still can have stories, and we still kind of laugh about these things. You can have that sort of team collaboration, but I don't think there's enough advocating for ourselves as individuals and what we need. And so I think that there's a real point that you're making. I actually can't wait to read your book and to promote that, because I think it's a really positive thing. Yeah. So anyway, Zach, I think you asked me a question, but I got off on another track. Oh, I know. You said, how did I keep making up these jobs? Well, you know, advocating and saying yes is really important as long as you have a true mission of what you're trying to accomplish. Use your voice. That's one of them. Would you rather take the positive road where you come up with a solution, or, you know, what they say is be part of the problem? And I don't think that there's many nurses that want to be part of the problem. They need to be empowered and given the opportunity to actually solve problems, and they will if you bring them in. And so I think that's really important. And so my role is in that I've been working in the probably last at least 10 years, closer to 15 years, is how do I engage frontline nurses and bring their voice forward. And we have to do that as a group. And I know that it's really hard to be a senior nurse executive, but you're not doing that for yourself. You're doing that for you're advocating for the frontline staff, because those are the people who are taking care of patients. Those patients could be you. Those patients could be loved ones. And if in my roles, the way I see it, if I don't allow them to do their best, then they're not going to be able to give their best. So I think it's also growth opportunities for what are we training our executives to do? Did the nurse manager above you or the leader above you, did they actually have training in healthcare systems leadership? Or was it because they were the last man standing? You know, that got put into the charge nurse role. And we have to recognize that that's how our systems have been, is kind of the last man standing is the one who's now the nurse manager. They have the longest longevity there. And so they must know the processes. So let's put them in charge. And I think that we can do better than what we used to do. And I really strongly encourage folks to look at the future of nursing reports. You know, that there's a lot of value in that, and it is the roadmap of our profession. And we do need to look at what the policymakers are calling forward for us through not only the future of nursing, but also for the essentials of what we're training in academia. Theresa, did you want to say something about that?
Oh, you just really made me think about, there's now, and you probably know this too, but people in the audience, maybe not. There's so much research being done now, well, compared to what had been done, that really shows the dollar value of nursing. Like you said, the meeting you went to, you made a business case, right? Like we now have evidence that there's a dollar value to staffing up, because you get fewer urinary tract infections, you get fewer hospital-acquired infections, you get fewer falls, you get fewer people who their emergency wasn't caught and they had to go back to the OR, whatever, all
you
things.
get less nurse burnout.
Right.
Let's
all
face
those,
it.
right.
Killing nurses, right? Let them actually support them with a proper workload so they can do what they need to do. Right. So, yeah.
Right. And it's, if when people want to bring a complaint, if you can make a business case for it, like I always say, the person who looks at what nurses cost is not the person who looks at what UTIs cost. So you need to make those two people talk to each other, and bringing in evidence that shows the value of this, we all agree on the social value, the moral value, right? That's what nursing is all about. But the arena we may have to move into is saying, no, this has a business value. We're saying safe staffing saves lives because it's true, and we think that's the right thing to do, but that also saves money. And so say yes. And if you have facts you can be armed with, bring your facts.
Unless that nurse is holding their bladder for so long that they get a UTI, then those things sort of come together.
Good point.
That happens so much when there's not enough
Mm-hmm.
staff on the floor
That is a
take
good
breaks.
point, Zach. You got me on that one.
Mm-hmm.
There's a lot of value also in using your voice with interdisciplinary teams. Theresa, I think that's where you were going as well. So all this talk about artificial intelligence and machine learning, what I have found through the years, for many years now, working with the engineering teams and with the just general engineers, biomedical, whatever they are, computer science teams, they don't know the right questions to ask, though they're getting a lot of bias and they're getting a lot of incorrect assumptions. And so we're another area of opportunity, I think, to have your voice heard is, how about if you start researching artificial intelligence? It's not that far off. And quite honestly, I think a lot of people use it as a sexy term to mean they're just looking for patterns that you probably already know as a nurse. You see the patterns, you see deterioration, you see these things, and they're trying to use evidence through hooking into EMRs or looking at patient reports to mine that data to make assumptions about large populations, and they're asking the wrong questions. At least that's my experience that I'm having. I'm working on a CDC use case with our Data Science Institute group, and granted, it's a group of students and very, very, very smart graduate students, but even as of recent as last week, they're just asking the wrong questions. But I found that in my role as a chief nursing informatics officer is that the data science people that are trying to answer questions, they're just looking in the wrong corners because they don't understand. And so nurses' voices, there's a place in data science as well, in some of these non-traditional roles that could be really, really important and very impactful of how analysis and outcomes and comparisons and business cases are. But the way that you get involved is by saying yes and get involved with some volunteer councils.
Yeah, I think that's
Yeah.
spot on too, and getting involved with committees and councils and organizations, but it's also getting involved with each other and connecting with each other. And Keith, you work with the nursing community to help them find ways to network. Can you talk a little bit about some tips and tricks in networking with other nurses who maybe you wouldn't have bumped into before?
Sure. Well, in the really fast-paced 21st century, it's really hard for people to necessarily meet each other. And in the context of the pandemic, when we're not traveling, we're not going to conferences as much, we're doing online virtual spaces like this one, it's harder to meet people. And networking can begin, and I believe should begin, when you're in nursing school. The first day you sit in your first seat in your first class of nursing school, the people who you're in class with might someday be your colleagues or your boss, or you might be their supervisor. They may somehow figure in your career 10 or 20 years down the road. You never know who you're going to run into. So each person you work with, each person you encounter, each person across disciplines can become part of your network. And I like to call that your personal brain trust. And like Theresa and I met each other probably on Twitter, Theresa, I think probably on social media. And I've met some of my very best friends through social media, LinkedIn, Twitter, Instagram, etc. And one is that if you're going to be out in the space networking, realize that you're a public figure to some extent, right? You're putting yourself out in the world. Maybe not a public figure like Theresa is in the New York Times, or like I am with a podcast, but still you're expanding beyond the immediate, your immediate orbit around you. And networking with other people, whether they're nurses or not, what it does is it expands your consciousness, it expands your reach, it gives you other perspectives from other states, other cities, other countries, other continents, and it gives you the ability to think critically about your relative position. What's happening for you in Pittsburgh might be quite similar to something happening to someone in Topeka, or it could be quite different. There might be something you could learn from that person, or there might be someone who works for the National Health Service in Brighton, England, who might have an insight that you might not otherwise have gleaned if you hadn't, say, saw what they posted about it on Twitter and wrote them and say, hey, I'd love to hop on FaceTime with you and have a conversation. So what I recommend bringing to your professional life is this sense of curiosity. And what Kelly's talking about, what Theresa's talking about, I think a lot of it comes down to intellectual curiosity, but also emotional and relational intelligence and curiosity, a desire to understand other people, to understand what they're experiencing, to look at your own experience in relation to that of other people, and filling your life with people who can bring other perspectives into your consciousness. And I think that form of networking, using curiosity as the foundation, the basis of why you reach out to other people, why do you talk to others, I think that can really do a lot for your personal growth and your professional growth. And I talk to a lot of my clients about this. I talk about it and write about it on my blog and podcast, because I feel like nurses need to get out of their silos and they need to look beyond their immediate environment and expand the way they look at the world. And whether you're talking to someone who has a PhD in English, or you're talking to a nurse with a DNP, or a nurse who's just finished their associate degree, there's something to learn from that person and your relationship to that person. So that's kind of where I come down with networking, and it can bring many, many benefits and yield a lot of wonderful things in your life if you're open to it.
That's great. I didn't expect to get such a positive life lesson out of this, but I think that's just being curious and Kelly talking about saying yes. I think these are all
Mm-hmm.
really great things for your career, but also just for
Mm-hmm.
yourself. So I love that. I'm going
Thanks.
to wrap this up with one last question for everyone. It's not necessarily a question, just we're all meeting here today talking about how we as ourselves can use our voice for good, how we can empower bedside nurses, managers, chief nursing officers, everyone in this healthcare industry to use their voice for good. So we'll give everyone one last opportunity to leave our listeners with one additional thought. Theresa, let's start with you. What's the one last thing that you have to say for our listeners here?
Believe in yourself. You know what the right thing to do is. Trust your judgment. You'll learn as you keep going. Believe in yourself. You can do this.
Certainly worked out for you, Theresa. I think that's great advice, and then that empowerment is so important. Keith, what would you have to say?
I would say that one of the large pieces or an important pieces of advice I have is to seek self-understanding, because if you're self-aware and you bring self-compassion to that self-awareness and seek to expand your own knowledge and expand, like I was saying in my last response, your consciousness, for lack of a better term, I think that allows you to be a better nurse and a better citizen and human being and community member when you allow yourself the breadth and depth of experience to truly understand who you are and what your motivations and values are. And if you can understand those, then that can inform how you approach your workplace and your work relationships and your career development and the ways in which you choose to advocate for patients or your colleagues or yourself.
Achieve self-awareness and then believe in that self. Kelly, what do you have to say for our people? Last thoughts here before we clock out.
Last thoughts would be is things that other people don't know because you're a nurse and you're working in that environment, and unless you speak up, it's not going to be known. So I would really encourage you to keep that in mind. You know things that others don't know, and you are experts at what you do.
And every year you just gain more and more information. There was this moment for myself when I looked around and I realized that I was actually one of the more senior nurses on the department. And I said, I'm not a newbie anymore. I'm not, you always had this feeling that you're just barely entering the workforce, but by believing in yourself, having that self-awareness, and recognizing your own intelligence and expertise, I think are all critical pieces of advice that we can give for our nurses out there. Thank you to all of the panelists here. This has been a wonderful, lively discussion. Hopefully everyone takes the opportunity to check out the other panels for this year's second annual Nurse Wellbeing Week. Thank you so much, and we'll talk to you guys later.